I want to kind of give you a broad overview first of kind of like what we're talking about, and you asked a question about, is numbness a part of arthritis? Well, it can be. And the reason is that I say that like that is that when we talk about conventional medicine terms, it's not really a wonderfully helpful term, like arthritis. The term arthritis means what? It means arth, which is joint, and itis, which is inflammation of the joints. So it's basically a $10 word for what you already told the doctor that you have. Like, gee, I got these pain in my elbows, I have pain in my knees here, doc. What's going on? Well, you have arthritis. Well, it's not very helpful. In Chinese medicine, we have a little bit more descriptive term that might possibly seem kind of strange, but when you think about where a lot of this medicine, Chinese medicine, came from, Chinese medicine came from an agrarian society, and so a lot of the terms that they use are terms from nature that try and describe the terms the conditions that were going on with that person. So one person's arthritis might be described as wind invading the body, causing you to have a problem. So that probably sounds a lot stranger than arthritis, but it's actually a little bit more descriptive, a little bit more helpful, because you're going to have different, I've had 5 different people that come in to see me and they all have arthritis. I'm going to have 5 different descriptions of each of those person's symptomatology. So the person that comes to see me, if I'm looking at wind invading the body, what kind of a pain would that be? If somebody had arthritis pain that was caused from my perspective of wind invading the body, that person is going to have a pain that comes and goes without warning. It moves from location to location, has a rapid onset, kind of like the wind. It just kind of comes and goes. So it's a little bit more helpful. Another person comes in, same diagnosis, I have arthritis, and so this person might have a condition that we describe as cold invading the body and causing a problem. So what kind of a pain, what kind of an arthritis pain would that be? It would be the type of pain that would be fixed and stabbing in location. It would feel better with heat. It would feel worse with the cold. Very stiff. So if you can imagine that, wind, cold invading the body. Another person's going to be having a condition we might describe as dampness invading the body and causing a problem. So what kind of a pain would that be? Well, that would be kind of like the pain that you describe. It would be like maybe a numbness type of sensation in the body, a sense of fullness, a sense of swelling. That person would feel worse in the damp weather. Those are the people that tell us what? Storm's coming, I know it's coming. So these types of descriptions are where I kind of look when I'm looking at somebody that comes in to see me and they have arthritis. Now, one of the things that we're working on in arthritis is we're looking at a blockage, a stuckness, a stagnation in the system. Now, when I say the system, we're talking about the circulatory system. When I'm talking about the circulatory system, I'm actually talking about the energy circulatory system. And that's probably one of the most difficult aspects for people to be able to kind of gravitate towards when we talk about stuck energy in the body or deficient energy in the body. But I think it makes a lot of sense sometimes to take it right back to the ultimate. If you were with somebody and that person was dying, okay, so they're here, and now 2 seconds later they're dead, what's the difference between this state and this state? Still got all the nerves, all the chemicals are still there, the hormones are still there, the neurotransmitters are still there, everything is still there. There's just no life forces making any of those chemical processes happen anymore. That's the level of energy that I'm talking about. So when I'm talking about, gee, how's your energy? Well, I feel pretty good today. Well, yeah, you're vertical, but where are you in this stage of verticality, or are you moving closer? Are you closer to here, or are you closer to here? So you see, it can have, and that energy can be disrupted by lifestyle things that are going on, things that are where mental, emotional factors. So there isn't any separation between the body and the mind. So this is kind of like what I want to kind of bring together for you tonight, is that there's this dynamic interrelationship between all different parts of us. There's no one thing that's going to cause anything. Actually, anything can cause anything.
Okay.
Yeah, I mean, if you think about it, you have mental, emotional things can certainly cause muscle tension, and muscle tension makes muscle contraction, and muscle contraction makes pain, and pain causes anxiety, and anxiety causes muscle tension. You get these vicious cycles. Well, where did it start? Did it start because you fell down and whacked yourself and started getting pain? Or did it start because you had something, your kids are out there and they're messing up and it's causing you to be like this all the time and causing you to have, contraction in your tissues? Or did you eat something that was a stressor for you? Because when you come in contact with things, those are more like chemical stressors. And we have to talk a little bit about stress, the concept of stress. The concept of stress is not just mental, emotional things that most people think about as stress. You can have any kind of stressor. And the picture that I like to keep in mind when I'm thinking about stress and talking about stress is the picture of a tiger sitting right here. If you've got a tiger sitting right here, then you're going to probably have a few systems in your body that are not going to work properly. You're not going to be getting ready to digest food. Hydrochloric acid isn't something you're going to be manufacturing when you have a tiger sitting right there in front of you. So you can certainly have gastrointestinal problems. Tiger in front of you, you're probably not going to want to have sex, and you're not going to want to go to sleep. Those are probably three factors you're not going to want to do when the tiger is there. So you can see that stress can affect hormonal balance, it can affect gastrointestinal balance, and it can also affect the immune system. It's not so important to be thinking about the problem that somebody has. It's much more important to be thinking about the person that has that problem. There's 5 different people coming down, all having the same diagnosis. They're going to have 5 different ways of describing what it is that they have. So if I just treat everybody that comes down here with the diagnosis of arthritis the same way, just because they have the same diagnosis, but they have a different configuration of symptoms, they got to their condition of arthritis for a different reason than somebody else did, then I'm not going to get the same results as if I individualize with somebody what was going on with them. That makes sense? Mm-hmm. So that was the first slide, so let's see what we got. Let's see. So I won't read all these things. Certainly, you can read them. But certainly you get the idea that there's certainly a lot of people in the country that have arthritis as the population gets older. And that's another thing, isn't it? What's a big diagnosis? You go to somebody, a doctor, and you tell the doctor you have this problem. Well, you're getting older. So your diagnosis is shelf life, right? Yeah.
Private.
Yeah, you've got excess shelf life. That's your diagnosis. You got a pain over here. What is it? Oh, well, you're getting older. Well, I know, Doc, but this one's the same age as this one. What's the deal here? And so, we'll slow down. The problem is not about aging, it's about degeneration. And the degeneration of our tissues doesn't have to happen on a time schedule because you reach a certain age that you know people that are in their 70s and 80s and they're out there vital and live and walking around, and you know other people that are in their 50s and 60s that are basket cases, right? I mean, we all do. Yeah. It doesn't have to be this fait accompli that you reach a certain age and you're supposed to be having this type of behavior and looking this way and all of it. So it doesn't have to be that way. So just what we were talking about, arth is the joint, itis is inflammation of that joint. And kind of like what we talked about, different types of symptoms people are going to have. You might have a red, hot, swollen joint, and somebody else it might be more contracted and difficult to move, and worse with the cold weather. But it's basically a breakdown of the cartilage. Now, arthritis, I can't tell you how many times people come in and they tell me the diagnosis is they have arthritis. Okay, you have arthritis, and it's told to me as if that's it. You know, I have arthritis. There's nothing that can be done. The doctor told me I had arthritis, and that's it. You know, take painkillers for it, take anti-inflammatories, you know, take all of these things. But it wasn't. If you started getting arthritic pain and you finally go to the doctor, it's not like your pain just started, or your problem, the process of degeneration started just when the pain started. You had to have had a process that was in place that made you kind of slowly deteriorate, and finally that simple, you know, maybe like, it went like this. Oh my God! Just threw my back up. My back wasn't okay 15 seconds now, and I bend over to pick up the pen and throw out my back. Right? I had to have had some kind of a process that was in place that made me kind of deteriorate and slowly, you know, all of a sudden I wake up and I bend over to pick up the pen and throw my back up. So that's not the way it happens. So when we finally reach that point, that's the end result. So now you go into the doctor and you get the x-ray, and the x-ray shows, yep, you have arthritis. Well, okay, that's not the reason why you degenerated to this point now where that picture shows that you have arthritis. You had this condition going on a long time before you had the arthritic pictures show up. Yeah. So arthritis is a process, and most of the time it's happening, well, several different reasons, but the major one is inflammation. Inflammation is going to cause a degeneration of tissues.
How do you get the information? I mean, how do you know you have the information in your body?
This is an inflammatory substance. That's one thing. You can do a blood test and find out you have elevated interleukin 6s. Yeah, you can find that out. You can get inflammation from any of the thousands of toxic substances that are out there that we're exposed to on a regular basis. Those cause inflammation in the body. You can have inflammation from your diet, eating things that are inflammatory in nature, like partially hydrogenated vegetable oil, genetically modified foods that we eat, and hybridized wheat products that are very inflammatory, causing us to have things like celiac disease and
from wheat?
Yeah, wheat is one thing that is it can be very inflammatory. I'm telling you this because 99% of the wheat that's grown right here in the United States has nothing to do with those amber waves of grain that were out there flying around in the prairies. That plant doesn't exist anymore in this country. That plant has been hybridized, so it's about 1.5 foot high now, and it has a whole bunch of different wheat berries on it. Well, that plant is completely different than the one where you just had one wheat berry right at the end of the stalk. And then it has way more gluten. Much more gluten. Gluten can be very inflammatory to the body.
I didn't know that. Here I've changed to wheat bread.
Yeah, I know.
And everything.
I know. I'm with you. You know, it's almost all of it. I mean, even if it's organically grown, carried across the desert on the back of Moses, it's still that.
Yeah.
It's still that hybridized wheat that they use. Now, I've had people that are very sensitive to gluten, wheat products here, and they go to Europe and they have wheat over there, they're okay with it. They can have it. They go to Italy, they have the pasta, and they're okay. They're not having a reaction that they would have had if they had, you know, Prince spaghetti pasta here, or any brand, really.
Yeah.
So the food supply is not the same as it used to be, and so those things can be inflammatory to us. Gluten sensitivity is going to cause, and this is another way that we can have arthritic type symptoms. So I'll take you through a little journey through the gastrointestinal system. So, okay, you eat something and it gets into your system, and you don't have enough hydrochloric acid because you've been dealing with the tiger that's sitting there in front of you. Okay, you're not digesting foods, you don't have any digestive enzymes that you're making, and hydrochloric acid that so what does the food do? The food decomposes, and it causes a very acidic environment in your stomach, You start to get heartburn, indigestion, reflux, actually because you don't have enough hydrochloric acid. Food doesn't start digesting the way it's supposed to in the stomach, goes into the small intestine. If you're not lucky enough to have your gallbladder there, a lot of people don't have gallbladders either, right?
I don't know, I don't get into that. I really don't, you know.
Yeah.
It's like,
Yeah, they take the gallbladders out. A lot of times people have the gallbladder taken out. Well, gallbladder, one of the things that does is it squeezes bile into your small intestine. That helps you to digest food, so people who don't have the gallbladder, compounded,
oh,
I'm giving you another complication here, that food, in other words, the point is that the food starts going through your digestive system and it doesn't digest. And that causes a very inflammatory condition in the small intestine as you go through there, and causes a condition called leaky gut. Have you heard of leaky gut?
no.
Okay. Yeah, these are all things you can just go on the internet and look these things up. But leaky gut, kind of, a good description of it is kind of like what really happens. Your food that doesn't digest becomes inflammatory, and it causes the membrane, the small intestine membrane, to become very porous, so that the food will leach out through the gut wall and get into the bloodstream. So now you have cucumber in your bloodstream, or whatever. So now your immune system has to handle this. It's an invasion into your system now. And so now the little macrophages, the little Pac-Men, they come in, they glom onto these food particles, and they form these big things called circulating immune complexes. And so those circulating immune complexes will circulate through your blood, and they'll settle into your joints, into your tissues, into your joints, and cause you to have symptoms that will look like fibromyalgia, chronic fatigue syndrome, arthritis. Okay, it can cause an actual, and from that perspective, you know, trying to fix somebody that has arthritis from that perspective means that I have to do what? I have to fix the gut. I have to fix the stomach. It's not a question of, here, take these anti-inflammatories because you have pain in your joints here, right? You want to try and touch the underlying reason why somebody has the problem that they're having, and not just treat the symptoms that they're having. Because that symptom in the joint is just the final end result of a degenerative process that's been going on in your body that finally makes it show up as a symptom. And symptoms are the only way that your body has of letting you know that there's something wrong here, there's something going on, so I need to give you a signal here. And the signal that you're getting is pain. So, what do most people do when they have pain? They take something to make the pain go away, right?
Oh, yeah.
Like an anti-inflammatory or a narcotic or some kind of painkiller to make it go away. Well, isn't that just the same idea as taking a piece of black electrical tape and putting it over the warning light on your dashboard, the car dashboard that says you need oil? Need oil, okay, light's flashing at you, I'll just put a piece of tape over it. It's kind of the same thing, isn't it?
I would have read it, yeah.
So symptoms can kind of sometimes be really your best friend. It's a way of it's the only way your body lets you know that there's something that you need to fix here. I'm not saying don't take those things, don't do those types of things. I mean, you do what you have. If it's really bad pain, you finally had it go as far as it has, and you're having a really difficult time, then you do what you need to do to make yourself comfortable. But if you just have to keep on doing something all the time, then, and I don't care whether it's pharmaceutical medications that we're talking about here or it's Chinese herbs. If you have to keep on taking something all the time, it's not really addressing that underlying reason why that problem is happening, is it? So we have different kinds of arthritis, osteoarthritis, and you know, that's the one that's usually slow and progressive, coming after age 45, and hips and knees, back, low back, fingers. Yeah, we kind of think of it as it's wearing down. The joints are wearing down. Well, it's not that they're wearing down, it's that they might not be regenerating. They might not be regenerating because you've got too many inflammatory substances that are causing that. You have, well, we'll talk about the other one, the immune reaction, and we'll talk about it in a few minutes. But we usually think of this when you're undergoing excessive stress and it's applied to a weakened joint. Now, a lot of times the joints will weaken, they'll wear down because the connective tissue isn't holding the bones in place. And so a lot of times people think about, well, I'm getting bone on bone. Well, why did that happen in the first place? So let's say you have a knee joint here like this. These bones are held together by the ligaments. And when ligaments get stretched out, they're not like rubber bands, they're not like muscles that just kind of go back again. They stay stretched out like this. So what happens? You have loose ligaments here holding those bones in place, and you end up having the bones kind of slosh around on each other, and they'll start to form bone spurs, and because your body's infinite wisdom says, hey, I got some irritation down here, I'm going to send some extra calcium down there and build some bone down there, and you get bone spurs. And so the solution for that is get those ligaments tightened back up again. And in that situation, the only thing that I know of that's going to really do that job of actually making new connective tissue, tightening up those ligaments, is a process called prolotherapy, P-R-O-L-O therapy. Prolotherapy is an injection therapy, but it's completely the opposite of a steroid injection. Prolotherapy, the active ingredient when we do prolotherapy is dextrose. So what's dextrose? Dextrose is sugar. So why would we use dextrose in order to help the ligaments tighten themselves back up again and also to regenerate new tissue? Well, you know, if you take a chicken, you look at the chicken dinner, you open up the chicken and you look at the ligaments and the tendons, they're white, they're clear, right? Mm-hmm. There's no blood supply that gets to tendons, and ligaments they have a very poor blood supply. So when they get injured, they don't heal very well, if at all. And so what we need to do is get the circulation going to that part of the body. Why we use the dextrose is we put a little bit of dextrose right at the junction of the bone and the ligament, or the bone and the tendon, and leave a little bit of dextrose there. What that dextrose does is it purposely causes a very mild inflammation at that spot. It's almost like spot welding. And that inflammatory process is your body bringing things like chondroblast and fibroblasts and collagen, elastin, things that make connective tissue, actually bring those things right to the area, and you manufacture new tissue there, and it tightens up the ligaments. So it's a different. So it's really a complete opposite of what a steroid injection would do. And we're in prolotherapy, we're actually using the body's natural inflammatory process to heal itself. A steroid injection is completely squashing the function of the immune system, so it can't pump out those inflammatory substances. You may feel okay initially because it'll take down the swelling a little bit, but the research is very clear on steroids that they just don't work, and if they do work, they don't work for very long. So there can be a genetic component to arthritis. Some people have, and I don't know exactly if that's a genetic aspect, or a lot of times family members have a tendency to generate the same types of problems because they have the same type of diet, they have the same type of lifestyle, and so a lot of times families have a tendency to generate the same types of problems. So is it really in the genes, and you're going to get it as a consequence of who your parents were, or is it a lifestyle thing? Most of the time it's lifestyle problems, because even if you have a gene that says that you have a predisposition to getting this problem, that's all it is. It's a predisposition to getting this problem. It doesn't mean that that gene has to express itself. You may get it, but you may not get it as long as you're good. So you got to be good. I know it's no fun at all, huh?
I've been eating healthy for ages, and I still got arthritis.
I know.
You know?
I know.
It doesn't make sense.
Yeah, I know. You're just sick of going to bed with arthritis and waking up with Ben Gay, right? And here's your secondary caused by trauma. You know, people say, "Oh, you injured that leg there. You know, when you get older, you're going to end up having arthritis there." A lot of times that's because that original injury made a susceptibility to having those tissues wear down because ligaments weren't holding themselves in place too. Okay, so then we have the autoimmune aspect of arthritis here. We're coming in with rheumatic arthritis, and rheumatoid diseases, and arthritis is one of those, but we can get things like lupus and so those types of psoriatic arthritis is a autoimmune condition where after repeated expressions of suppression of arthritis skin problems, people sometimes will develop rheumatoid arthritis because of the suppression. And it can affect the internal organs, the ligaments, tendons, or muscles. Now, rheumatoid arthritis is a little bit different animal. Rheumatoid arthritis is, when I say those words, autoimmune, does the concept of autoimmune make any pictures in your head when I say autoimmune?
It means I'm allergic to everything. That doesn't.
Well, that certainly can be a process. Yeah, that can be also, but it's you're not too far away from that. So autoimmune means that your immune system that's supposed to protect you from the whole world,
right?
You know, it's supposed to protect you from bacteria and fungus and yeast and viruses and splinters. That's what the immune system does. It protects us from the rest of the world. Well, when you have an autoimmune condition, what's happening is that your immune system that's supposed to be protecting you against all of these bad things is starting to look at a particular tissue in your body as if it was the enemy. And your own immune system starts a destructive process on a particular tissue. And depending on which tissue is being attacked, the name of the autoimmune disease is going to be different. If your immune system is attacking your thyroid gland, then you're going to have Hashimoto's disease, or you're going to have Graves' disease, so autoimmune thyroid. If your immune system is attacking your nerve tissue, you're going to have, the diagnosis is going to be MS. If it's attacking the substantia nigra, the part of your brain that makes dopamine, then you're going to start having Parkinson's disease. If your immune system starts to attack your cartilage and your ligaments and your tendons and your connective tissue, then you have rheumatoid arthritis. But it's the same process. It's not a problem with your ligaments and your tendons and your cartilage. It's not a problem with your brain. It's not a problem with your nerves. It's a problem with your immune system that's attacking those tissues. Now, yes, you need to do some things to support those tissues, because there are other parts of your bodies that certainly need those things. But you want to do things that are going to help to calm down the immune system without completely wiping it out, which is what pretty much conventional medicine. When you have rheumatoid arthritis, what you're going to get are things that will completely suppress the function of your immune system. Things like methotrexate and prednisone and Humira and all these medications that completely suppress the function of your immune system. And sometimes if you need something like that to get a little break sometimes, well, like I say, you do what you have to do to make yourself comfortable. But if you're on those things for long periods of time and you have a completely squashed immune system, what does that do? It leaves you wide open for all kinds of opportune infections to come in and invade your body and cause you to have all kinds of other problems. So it's not a long-term strategy for you to go through.
So how do you get off the medication?
While you're feeling comfortable, what you want to do is try and find out. We're we're getting into more here than I'll get into this in great detail in the autoimmune lecture, but there are different aspects of your immune system that need to be evaluated to see if you're a Th1 dominant person or a Th2 dominant person, and you get the idea. There's more to it than I can go into right now. Okay? So you find out which one of those you are, and depending on which one you are, there's strategies that you can use to kind of get things more balanced off.
Okay.
So 2 weeks I'm doing that one, I think.
All right.
Now, interestingly, this is kind of an interesting slide. Rheumatoid arthritis affects more than 2 million people in the United States. Women are 3 times more likely to develop rheumatoid arthritis as men. Now, what does that tell us? Just that sentence all by itself has to tell us that there's an intimate relationship between the nervous system and the hormonal system and the immune system, right? If the immune, because
Tells you women are under stress more than men.
well, that's because the cause of all stress is right.
That's for sure.
Now I say that half jokingly. Stress, because stress comes in different flavors. So we got men here. This is mechanical, okay, or physical stress. You know, you have physical stress, mechanical stress. You fall down, you get whacked, you have an operation, you work too hard, you work out too hard, you don't sleep. That's mechanical, physical stress. When I say stress, remember the tiger. The same physiology kicks into your body as if the tiger is there. And that physiology that's kicking into your body to deal with the tiger was only meant to be there for a short period of time. When you're in a situation where you can't get out of it, you're working for a boss that's a jerk and you can't punch him out and you can't run away, then you kind of have those stress hormones build up in your body all the time, and they start to really cause a autoimmune, start causing an autoimmune condition.
Oh, really?
Yeah. So stress is the ultimate cause of everything. So here's another M, so that's the M part of it. Emotional, mental stress, right? That causes the same hormones to pump into our body as if the tiger was there, same deal. And then we got nutritional or environmental or chemical stress. That could be industrial chemicals, environmental pollutants, a lousy diet, drugs, allergies, sick buildings, all of those things. Those are chemical stressors. So, same idea. The tiger's there. Here's what happens. You eat something you're allergic to. Your body has a stress response. You eat a piece of, let's say you're gluten sensitive. You eat a piece of bread that has gluten in it. Your whole body is in this fight or flight response. Your whole body, just eating that thing that you're allergic to, makes your body go, oh my God, I'm gonna die, I'm gonna die, I'm gonna die. So you're gonna be pumping out hormones and chemicals in your body to help you to deal with that stress. It's the same stress. Whether you fall down and hit yourself and whack yourself, you've got stress hormones pumping through your body. Your kids are out there screwing up with their life, and now you have to deal with it because they're messing up, and causing you to have stress.
I don't bother with that. That's their problem.
You know what I mean?
Yeah, I know.
I can
know what
take
you mean.
any kind of it, or
Yeah.
when you eat something and it's not good for you, you can have a stress response in those cases. And if you constantly expose your body to the stress hormones, whatever kind of stressor it is, then it's going to cause you to have problems. And certainly you can fire up your immune system to start saying, okay, because this is really very interesting. There is this process called cellular mimicry, where you eat certain things and they have the same chemical, not the same, but they're similar in their response. The immune system responds the same way to these like gluten, will respond to the same way as it does when it responds to the thyroid tissue. So if your immune system is already fired up to be attacking thyroid tissue, like Hashimoto's disease, and you eat some gluten, that gluten will act as a cellular mimic to thyroid. In other words, eating gluten is going to fire up your immune system to start attacking the thyroid even more so. And there are many case studies that have done, physicians all over the country have done case studies where they've had people get off of gluten, all their autoimmune markers for thyroid go away.
So if you eat something that you've ate all the time, and all of a sudden you get a reaction to it.
You can. Yeah, you can. I mean, you can certainly get a reaction to things that you eat on a regular basis all the time, yeah. If you overdo anything, sure.
Okay.
And most people, I get dietary histories from people when they come, and I have to tell you that most people eat the same 15 things every week.
Yeah, I found that I do.
Yeah.
It's easy. Go ahead.
Yeah, exactly. So how do we protect ourselves? So, and I'll take a look at your survey and take a look. So there's some tests that you can do. So just sitting there, if you just took and turned your head to the side, just sit nice and even with you, just for a second. Okay, and just turn your head to the side, and turn your head to the other side. Okay, was it easier to turn to one side than the other?
Yeah, to the right is easier.
It's easier. Okay, so if it's easier to turn to the right, then you flunked the test because it shouldn't be. That means if it was easier to turn to the right, then you had difficulty turning to the left.
It's just a little uncomfortable more this way.
Yeah. So it's a sign that there's an imbalance, right? You shouldn't have difficulty going to one side.
So how do I get my balance back?
We try and work on some of those underlying reasons why that's happening. That could be. So my job all the time is to find what's the source of the stress. In all these different categories, what is the source of this person's stress? Do they have a hip problem because every time they're standing up, they kind of hang over here like this? That's going to cause stress, right? Is this person walking around with a wallet in the back pocket all the time? You can imagine that if you had a big, thick wallet like this and you have it in your back pocket and you're sitting down all the time, I'm going to exaggerate a little bit, that your hip over the side here, you kind of like you're sitting like this all the time, right? If you're a truck driver and you're like that all day long, bouncing around on that wallet, you're going to naturally can imagine how if this was off, it's going to throw everything off, right? And so these are tests that you can do, and you can see you're doing it on one side and doing it on the other side. Just check yourself out and be honest with yourself and say, okay, was it more difficult going to this side than the other side?
I've been doing these little things, starting doing the balance and stuff.
Yeah.
Finding you get off balance.
And that can be for many different reasons, certainly.
Yeah.
So you think this might throw you off if your shoe is worn down like this on the inside here all the time? If the inside of my shoe is worn down, then I'm going to exaggerate again, but I'm going to be kind of like with too much pressure on the inside here like that, right? So you think if I'm kind of like this a lot, is the inside of my knee getting a lot of pressure? If I'm like this is even, and my shoe is worn down so it turns my foot like this, it's going to put pressure. It's going to put pressure on the inside here.
I got new shoes.
Yeah, you see what I mean? It's something like that.
So you don't even notice when it wears down, I would imagine.
Yeah, and it's because
otherwise people wouldn't walk right.
They don't notice, but they are walking with their knees like this.
Oh, okay. Huh.
So you think that might cause a problem over a period of time?
Yeah, yes, I got that. We all have that problem.
I don't.
Women.
So what would make sense if you were going to carry a bag like that would be to kind of carry it like New York style, wouldn't it? Like,
Yeah, it's over the shoulder.
like this, right? And so you think that might cause some problems with her neck over a period of time?
Oh, yes.
Yeah. So moving, you want to move. Keep it moving. Moving is going to get your circulation going. And again, it's not just the blood circulation, it's the energy that we were talking about, the stuff that heals you.
Yeah, I was playing tennis, but for 2 months I haven't been able to. So.
And that's a requisite. That's one of the requisites of getting somebody back into shape. So you got to get them to be able to move. If you can't move because you have pain, then we have to get you out of the pain. We get you out of the pain by trying to get to the underlying reason why you have that pain.
Well, it's just my wrist.
That's
I can
all?
move except for my wrist.
That's all?
I mean, I can move. I don't have no problem moving or anything, but hitting the ball.
Hitting the ball, right.
I can swing, but when it hits the racket, oh Lord.
And you know, health is what? Health is really freedom. Health is being able to go through the full range of human experience without having our attention drawn to any different part of our body, mind, spirit condition. I mean, if you have to be thinking about this little frame here, if you have to be thinking about, you know, this going on, or have this going on, or you thinking about this, if your attention is drawn to these different parts of your body, then you're not going to be open for the higher purposes of human existence. You're going to be kind of locked and stuck and frozen
I don't want that, yeah.
in the things that keep on drawing your attention. So if it's only my wrist, well, your attention is drawn to wrist, well, you're not really free. You're not in complete good health. Your attention shouldn't be drawn to a little finger or a little toe or whatever. When it is, then that's the only way your body has of giving you a signal to say, hey, pay attention, I'm here, hey.
I know, it was just...
Remember? Hey, over here, yeah, remember this?
Well, when I first started getting those swelling, I didn't quit. I just kept playing until one day I couldn't play.
Yeah.
Because I really liked it so much that I just kept... Now, 2 months I've not been able to do any of it.
You know, and certainly that can be for different reasons, right? That could have been from you didn't have good technique.
Well, I'm sure that has something to do with it.
I mean, tennis, certainly. You're not hitting the ball in the right spot here, and you hit it to the side, and it, you know, kind of goes like this.
The thing of it is, it's both wrists are the same. And I don't play left-handed. You know. But anyway.
Yeah, so I got it, but you got the idea that it could be from different reasons.
Right.
Yeah. So restricting motion, and so you can see all the bones in here. Again, all these bones are connected with ligaments. You have a ligament that goes from here to here. It goes from here to here. All these bones they're not just free-floating bones that are in there and stuck there because the skin keeps them in place. The skin doesn't keep them in place. There's ligaments that are not showing up on this here that hold the bones to the bones. And when those ligaments get stretched out, then you're going to start to have recurring sprained ankles and recurring knee popping out and recurring back pain and recurring neck problems and recurring shoulder, elbow, wrist problems. And it could be from degeneration. The degeneration caused from, like we talked about, the ligaments not holding the bones in place.
Okay.
So here's part of the training of acupuncturists. We use Chinese herbs, we use exercise, Qigong, and Tai Chi. Tai Chi all by itself has been shown to be a major benefit to people who have rheumatoid arthritis. As a matter of fact, the American Arthritis Association suggests that their members do Tai Chi to help them with their arthritis. So it increases the range of motion, and naturally, if you're going to use supplements, it makes sense to use whole food supplements and not just isolated, extracted nutrients. food is your best medicine. There are many different herbs, Chinese herbs that we can use that address those conditions we got started talking about, the wind and the cold and the dampness and the heat invading the body and causing problems. There are Chinese herbs that kind of address those aspects. So it's not like you have one herbal combination that you can take to help this person's arthritis. You have to kind of differentiate what kind of arthritis is this person having, and then make an appropriate herbal combination formula for that person. And the same thing with acupuncture. You have to individualize the treatments for people. You can't do the same thing on everybody and expect that you're going to get the same results. Fish oils, omega-3s, they can be very helpful because what they'll do is they help with the inflammatory process. Fish oil helps with inflammation. And antioxidants help with the whole idea of free radicals. Now, free radicals, does that make a picture for you when I say free radicals or antioxidants? Does that make a picture for you what that really means? I know, people talk about free radicals all the time, and yeah, free radicals are bad and antioxidants are good. So I'm going to give you a picture of really what they're talking about when most people are talking about it. Most people really don't know what they're saying when they say it. When we're talking about antioxidants and free radicals, I'm going to give you a picture that'll stick with you, and you'll never forget it. So this is a carbon atom, okay? So a carbon atom, it's got 6 protons. It's got 6 protons and 6 neutrons in there. So if that's what's going on, then it has to have 6, 2, 3, 4, 5. It's got 6 electrons all floating around there. That's what the electrons. So here's what a free radical is. A free radical is you only got 5 out there. So now what happens is this atom, I use carbon because we're mostly carbon. Okay. So this carbon atom has to complete itself, and so what happens is it goes over here and it steals an electron from this atom over here. Now this one is short, and it goes over and it steals another electron from here. And so you get this chain reaction that happens, and the way this chain reaction shows up in the physical body is tissue destruction. Rheumatoid arthritis, cartilage and tendons wearing down, wrinkles, hair and skin and teeth and bones, and tissue degeneration. Okay. That's the way free radicals show up. So how you fix this is you give people antioxidants. Because what antioxidants do is they supply the electron. So it stops this whole chain reaction from causing the tissue destruction in the body. That's what the main antioxidants that they use in the clinical research is glutathione and SOD, superoxide dismutase. Superoxide dismutase, SOD. Have you seen the Cindy Crawford commercial?
Yeah.
Okay. So with the melon and the magic cream that the French doctor made from the melons, and put it in this cream thing, and put Cindy's name on it, and it's wonderful stuff. That main ingredient that's in there is SOD, superoxide dismutase.
So which comes from fruit and veggies and
it comes from natural sources. But I can tell you, if you have a degenerative process that's going on, you couldn't eat enough blueberries to stop that process from continuing. It's really helpful if you have this degenerative process in place and it's happening. it can be helpful to take supplementation.
Oh.
And really the best way to get the proper dosage of that would be to use a cream. So I use a cream. I have a cream that I use, and it's got both of those things in there. It has glutathione in the cream and SOD, the superoxide dismutase. So I use a cream that's really nice. It gives you a tremendous dose of antioxidants, and you know, my daughter uses it all the time. She said it makes her skin feel really great.
Well, I eat enough fruit and veggies to, that's my diet usually.
Yeah, and that's great. You know,
Doesn't help with the joints, I'm telling you.
You know, and again, that can be, you can have reactions to, you know, even things that are good for you.
Yeah.
So that happens. So one of the things that I always get when somebody comes down to see me, I get a diet history from everybody. I get a diet history because if you're eating the same 15 things every week, then maybe we need to make some changes here. If you, okay, this is the way you're feeling now, and this is what you've been doing, even though it looks really, really good, something's not working here, so let's tweak it a little bit and, you know, make some changes.
So do you take insurance?
Insurance. That's an interesting question. I can tell you, insurance is going to pay for all kinds of things that won't work for you. I mean, if it did, you wouldn't be sitting here now.
Well, that is the only way I'm going to be able to pay for it. So
Yeah,
I mean,
well, you know, like I say,
it just things have changed a lot in my life lately.
right.
So
So, what do? You keep on doing the same things that you've already been doing that didn't work for you, or you kind of step outside the box and try something else?
I'll probably try something else. Yeah.
So, yeah, I don't know if your insurance covers. I mean, it might cover. Some insurances cover, but you know, you have to check with Sandy. Okay. And it might be as simple as, you know, making some changes in your diet, your lifestyle, your whatever.
You know, I eat fish and chicken.
I know, like I said.
How in the heck can you change the diet different to be healthy?
I don't know.
You know, that's what I'm saying.
I don't know, because I don't know what your diet is like. You're saying chicken and fish, you're saying vegetables. Some people are okay with different vegetables and they're not okay with other vegetables. Some people are okay with different meats and they're not okay with other meats. And
Oh, okay.
in other words, it's got to be individualized.
Yes, I see. I understand that. Okay.
There's no one diet that's going to be good for everybody.
Okay.
We come from different cultures.
Oh, yes.
And so it doesn't make sense that there's one diet that's going to be good for all human beings, right? So we got the Eskimos up in Alaska that live on meat and fat, and that's it. They don't get any vegetables at all during the year, right? And they have one of the lowest heart rates in the world. And then you got the Bantu people in Africa that eat pretty much a vegetarian diet all the time. They have a very, very low rate of heart disease. So if you have the Bantu people start eating whale blubber and seal meat, and you have the Eskimos start eating vegetables all the time, they're going to get sick. They're not genetically predisposed to doing that. So everybody has a different diet depending on their genetic, their cultural makeup. Some people handle fruits very well, some people don't handle fruits very well. Some people handle grains well, some people don't handle grains well. The grains that I'm talking about that are bad for us are the ones that have been messed with, like the wheat berries, you know, not genetically modifying, but they've hybridized that plant down to some plant that looks nothing like the original wheat product. Corn, you know what they've done with corn? They've genetically modified corn. Now, you know why they genetically modified corn? Huh?
To multiply it, I guess.
No. They genetically modified corn so that it's going to be resistant to Roundup. You know what Roundup is?
A disease, I imagine.
No, Roundup is the insecticide that you spray on the plants in your grass. So the weeds, that you spray on the weeds, so the weeds will die in the grass, so you just have grass and you don't have weeds in your grass. So you spray Roundup on the weeds, it kills the weeds. So they genetically modified corn so that it's resistant to the Roundup herbicide.
Oh, the one they advertise on TV, Roundup.
Yes.
How we doing?
Yep. So why would they do that? Because now you can spray that whole cornfield with, from an airplane with Roundup, and it's going to kill all the other stuff on the ground and lets the corn grow.
How we doing?
How insane is that?
Yeah, singing spray from the, yeah.
You see what I mean? It's not, these things are not the same plants as they used to be. Soybeans are all genetically modified, all those things. And, it's not so much just the weight, people being overweight, it's what people do to themselves in order to get to be overweight that causes the problem, and most of the time that's happening because of eating these types of things here.
That's the good stuff, though.
When you're eating like this, you're digging your grave with your fork.
Oh, I understand that. I would, yeah.
And then naturally exercise, walking, Tai Chi. I don't care. I usually ask people, what kind of exercise program do you have that you like? Because I don't care what kind of exercises somebody does as long as they're doing something. And most people, if they can't do anything else, they can at least walk. Even if they walk slow, they can walk. They can only walk for a short distance. They can keep on walking that short distance, and you keep on getting better and better and better. Like I say, Tai Chi all by itself has been shown to help people with arthritis. Swimming, swimming is great for people that just can't. I got this leg and I put weight on it and I can't do it. Well, you don't have to have any weight on it. You can swim, you won't have any weight on your joints. So bicycling is usually pretty joint friendly. And strength training can be the best. Strength training is probably one of the best things you can do to prevent yourself from getting osteoporosis. That's the best thing you can do. 73%, according to a study done in 1999, 63% of people with chronic arthritis use complementary and alternatives. 73% of the study participants found acupuncture helpful. Acupuncture ranked among the highest in terms of patient satisfaction for pain control. There really isn't anything better than acupuncture for pain. So the gift is the opportunity for you to come on down, bring your blood work down. I'll be happy to go through your blood work with you, and it won't cost you anything. You just come down and sit and we'll talk, and give me an idea of what's going on, what kind of symptoms, a little bit more history about your arthritis, when did it start, what the manifestations of your symptoms are. Are you going to be, like we talked about in the beginning, one of these people that I'm looking at is wind or cold or damp or heat invading the body causing a problem? Is it a stagnation of blood, a stagnation of energy? Is it, you get the idea, this could be any different reasons.